So I'll just start off with a brief introduction. I'm Sherry LaLiberte, faculty member with the nursing program at Vancouver Community College, and very pleased to be welcoming all of you here today for our second Health for All meeting. We are very pleased to be hosting John Millar as our first guest. He has been leading a policy initiative with the Public Health Association of BC's Policy Action Research Committee, and he's been working actively to develop a health-focused Green New Deal policy platform, which he's here to share about today. Former and first, John, Public Health Officer of BC. Am I catching that right? I'll let you introduce
Provincial Health Officer.
Provincial Health Officer, yeah, BC. And so yeah, we're very, very grateful to have you here today to share about that policy platform. And then we'll segue into a discussion after around how we can support that here within our Vancouver Health for All network. And we'll go from there. We're recording today's session just until the end of John's presentation so that we can share this with folks who weren't able to join us today. Can everyone see that PowerPoint okay? Okay, I'm going to mute myself. I'm going to invite everyone to mute themselves if they haven't already. And then John, just let me know when you're ready for me to turn the slide.
Yep, okay, I'll let you know. I'll just say up front that for everybody on the call, I mean, it seems like we're not in a rush on this. And so by all means interrupt, particularly for the students, if I'm using a term you don't understand or a concept that you'd like me to enlarge on, please just jump in. I think we've got time to divert as we go through it. Okay, so let's get started. Can we put the next slide up, Sherry, please? So just to start, because we're all talking about COVID these days, what have we already learned from COVID? The first is, just to go back one, first is that when we're faced with an emergency, even something as seemed very remote when COVID first emerged in China, it seemed like it was never going to get here, and we didn't need to do anything. But we need to act quickly, I think, is the point. When we see the scientific evidence of something emerging, we can't wait around. We need to take the appropriate action as quickly as possible. And the other thing to recognize from COVID, this in the second bullet here, is that when it's of the magnitude of this, where it's global, or similarly with climate change or war, it requires the mobilization of all sectors of society, all levels of government, national, provincial, municipal, and right down to the local community level. And all other sectors as well, the private sector and the nonprofit sector, et cetera, et cetera. So we need all of society to be involved. And we absolutely, this is really well demonstrated, we need well-functioning democratic governments to provide the best guidance through a crisis of this magnitude, to provide good governance, leadership, coordination, and the resources. Next slide, please, Sherry. And we also need to have and pay attention to well-trained and qualified experts in whether for any of these health issues. We need epidemiologists, public health people, economists, modelers, analysts, as well as good preparation. We're woefully short with COVID in terms of stores of equipment and supplies, and hopefully we won't ignore that going forward around climate change and the other issues we're going to talk about. And the other fascinating thing that has emerged here is that when we face huge crises like this, that have, the public got it very quickly once the communications got going, that financing isn't a problem. Money's not a barrier. We're seeing trillions and trillions of dollars flowing to address this thing. And governments can find a way of doing this, and won't go into all the economics of that, but money is not a barrier to addressing huge crises, and that shouldn't be presented as an objection to doing certain things, and that'll become important. I think the other thing that we've learned here is that the most fundamental thing is not the economy. It's not growing GNP, the gross national product. The most important thing for us as human beings is to promote human, mental, and physical health and the well-being of our society, and not focusing on money and profits and growing the economy. I think that's an extremely important lesson to bear in mind. And the last one I'll mention is that something of this magnitude requires international cooperation and agreements. And that's going to apply to climate change and addressing inequalities, as you will see. Next slide, please, Sherry. So where are we going from here? Everybody's talking about, you know, we're seeing the flattening of the curve now. We're definitely seeing that in BC and to some extent nationally and in other countries. And we're emerging from the pandemic slowly but surely, and people are starting to talk about returning to normal. But what I'm going to argue here is that we don't want to return to the old normal. The old normal was severely dysfunctional, because what the old normal represented was three interconnected complex crises. And these, very quickly, the first is climate change, global warming, which has been declared a national and provincial emergency. And very importantly, from the social determinants of health issue, is the persistent socioeconomic inequalities, persistent and perhaps even worsening inequalities, poverty, homelessness, and the marginalization of minorities, particularly Indigenous people, but also gendered, immigrant, and other people. And this, the outcomes from this, as I will discuss, have been declared a provincial emergency here. So we have climate change emergency, we have a health emergency here. And linked to both of these is the ongoing erosion of democracy that we've had in this country and in this province, and even down to the municipal level, because the power of vested interests, both individual and corporate, have compromised our ability to make the appropriate take the appropriate action, and therefore are causally linked to these other emergencies. Next slide, please, Sherry. So let's just turn to climate change for a moment. The COVID zoonotic pandemic, with zoonotic being an animal-borne illness, has been attributed by some to an increased human and animal interaction because of climate-related loss of wildlife habitat and deforestation, and consequently the increased interaction between humans and animals. And in the COVID case, many think it's related to the connection between bats and pangolins, which is a scaly anteater, and the selling of those in so-called wet markets in Wuhan in China. And we've had others like Ebola and many others that are animal linked. And so without taking action on the climate and the environment, we can expect more of these. We will get more of these. This isn't the last one. And moving to the second bullet here, we're already experiencing many climate-related impacts on health through air and water pollution, floods, droughts, wildfires, and hurricanes. When I look out the window here, we're looking at a smoke. I can hardly see Vancouver Island because of the wildfires in Squamish right now. And climate change is a declared emergency in Canada and in BC. And so going back to my earlier point, we're beyond waiting for this. We've got to move to urgent action now. Otherwise, we face the annihilation of not just the human species, but other species by the time the younger people on this call have children themselves. This is going to be on us. So we need to take action now. The time for more planning is past. We've got to take action now. We know what it is, so we're going to go into those things. So let's go to the next slide, please, Sherry. So the next problem of the three, remember, it's climate, social determinants of health, and thirdly, the erosion of democracy. Let's just talk to Sherry and my favorite topic, which is the determinants of health. So in Canada and in BC, we have persistent and in some cases increasing inequalities of both income and wealth distribution, as well as unacceptable levels of family poverty. We have persistent homelessness, and we have this ongoing terrible situation of the marginalization of our Indigenous communities, immigrant communities, gendered communities, the elderly. As we've seen in this COVID thing, we've warehoused our elderly in below standard care, and they've died in droves, and the disabled populations and others. So this is a severe problem. And this has led to an epidemic of what are called the diseases of despair. And those of you who are students may not have heard of this, but This is a well-established thing, epidemiology. We have, because of the polarization of our community and these inequities, we have a lot of people who are lonely, they're depressed. We have people exemplified by Greta Thunberg who are experiencing climate grief and expressing their suicidal thoughts around this. And we have widespread hopelessness leading to suicides. We have addictions, which are leading in turn to drug overdoses, which are really driving the death rates. Alcoholism, smoking, addiction to junk food, as well as violence, abuse, and homicides. And the point here is very important. Persistent high levels of inequality have a negative effect on everybody in our society, not just the poor, but right across, right up to the wealth. Everybody has got worse health. And so we're also seeing a flattening of the curve in the absolute wrong way. The life expectancy in this country, in this province, has been rising for 50 or 60 years. And now it's reached its peak and it's dropping. So we're flattening the curve on life expectancy, and there's a similar trend nationally and in other provinces. And the important point here, I think I really want to stress that we're seeing way more deaths from the diseases of despair than we on an annual basis than we are seeing from COVID. So this is an order of magnitude greater than COVID in terms of its health effects. So it's an extremely important, and it has been declared an emergency in BC. I mean, they've focused particularly on opioid overdose deaths, but all these other ones, suicides have tipped up, and we have more violence. We're seeing homicides and certainly ongoing problems with alcohol and smoking and diet and so forth. So this wraps up all the many factors around health promotion within this. And it is, as I say, a declared emergency. So we have first of all, a climate emergency, and I call it an emergency of the diseases of despair, if you like. Let's have the next slide, please, Sherry. And on top of that, we have the erosion of democracy. The concentration of wealth and power among the very rich, both individuals and corporations, has allowed vested interest to exacerbate both climate change and inequalities. The power of the fossil fuels industries is unbelievable. I mean, here we are at negative oil prices. I mean, the oil companies in the States will pay people to take oil right now. It's a most extraordinary situation. This is because they can't store what they're getting out of the ground. We've got a surplus. So they're paying people to take it. I've never seen anything like it. And at the same time as Justin Trudeau proudly declared a climate emergency, almost the same day announced that the government invested in a pipeline. So this shows you the power that big corporate entities have on government policy. And Jason Kenney's still asking for billions of dollars in bailouts in the face of the COVID emergency. It's just shocking stuff. And we have extraordinary breaks for the wealthy in terms of the tax system, which will go into both the wealthy individuals and wealthy corporations, which we'll go into shortly. The next slide, please, Sherry. So moving forward, I'm going to talk a little bit about the Green New Deal. We need to be thinking about a way of moving ahead into a new, green, zero carbon, equitable future. People are talking about a just transition to an equitable future. And as I've said earlier, and I think it's extremely important, we cannot delay action on this. This time has run out. We can't be doing more planning now. The good news is that people have been thinking about this for years, fortunately, and planning has been done. And we are poised for action to move ahead on this. The Green New Deal for Canada, which is a plan to address both climate change and inequalities and the restoration of democracy. So this is I'm just going to move now into discussing a policy framework related to this. We have motion M1, which is a motion before Parliament. It's called a Green New Deal for Canada. It was filed on December the 3rd, I think I'm correct in saying, by an NDP independent member, not an NDP. It's an NDP private members bill from Mr. Peter Julian, who's the NDP member for Westminster Burnaby. And I've just, because this is before Parliament now, I think that I'm calling this the greatest health promotion opportunity of my career for sure. It would be to promote the passage of motion M1, and I'll try and go through and show you what I think would flow from M1, because M1 is calling for addressing climate change action and addressing inequalities, not just at the national level, but for driving this right down to the local community level, municipal level, at all levels. As I said before, we need to mobilize the whole society behind this idea of a Green New Deal, including the private sector and the nonprofit sector and all health promoters, I would suggest. The next slide, please, Sherry. In this policy framework, we're going to assume that there is wide support to implement a just transition to an economy, and polling in Canada does show that there is wide support of something like a Green New Deal. Something of the order of 60 or 70% of the population have said they support this concept. And the notion of moving from getting a just transition to an economy and a social system based primarily on renewable energy rather than fossil fuels, and a commitment to more social supports and shared prosperity. This transition will be characterized by a winding down of our dependence on the extraction and consumption of fossil fuels, and the creation, very importantly here, of millions of new jobs that will involve the development of renewable energy infrastructure across the country, as well as jobs in care, such as child care, adult, elderly care, and so forth, and education, ranging from early childhood education through to university and college education, and including skills training and so forth, with a particular focus, and this is very important too, on giving priority to regions such as Alberta that will be hit the hardest from the decline in the fossil fuel industry. Next slide, please, Sherry. So let's just turn to income inequality, first of all. What are some of the policy recommendations? And I should mention, because Public Health Association of BC has already come up in the conversation, that this entire policy framework has now been adopted by the Public Health Association of BC, and has formally been approved by them, and will be up on their website and is shareable and will be used as a way of advocating this policy framework to the national and across the country and to all levels, and should really help with the effort of moving this along. So these policy issues are important to be aware of. So the first one is to increase the minimum wage to a living wage. The second one is a very interesting one, is moving towards a guaranteed livable income. The CERB, the COVID emergency response benefit, which is already out there and being expanded almost daily to more people that become eligible for it, is as Hugh Segal said in the Globe the other day. Hugh Segal's a conservative senator, or was, and he's been advocating for a basic income for years. I think he had in mind something a bit lower in its magnitude, but you know, the current one is right up there at a living wage level. And so a guaranteed livable income for everybody in Canada is that one. That's going to be extremely important, and hopefully there will be an assessment of the CERB, and the conclusion will be, yes, this is a good idea to give it to everybody in Canada. And the third one is to increase the disability assistance rates to something similar. And if the rate's high enough, then they probably will need that plus some extra for their living expenses. The fourth one's a very important one, coming out of the notion of this idea of creating millions of new green jobs. There's a federal job guarantee. And this is an important concept from what we know about why inequality gets under the skin and causes disease. Most people, the vast majority of people who are able-bodied, do want to work and contribute in some way. And as I've said, in this new society we're hoping to craft here, It may be in care, it may be in service of some kind, it may be in the arts, we don't know, but there will be a job guarantee for everybody with a living wage. So that, the basic income may not be really needed for most people, but there will be some who fall through the cracks. The other important thing here is to increase employee corporate power sharing so that employees have more say in the management of a company. So co-management, cooperatives, shareholding, more union membership and employee ownership are all ways that could be incentivized to do more of this so that we don't even have to think about redistribution. Employees will be better paid to start with, will have better benefits. And the last one here is to make housing a right. Implement homelessness programs like Housing First, where we have housing for everybody and with the wraparound social services that they need and rent control so they don't get out of control. Next slide, please, Sherry. And we need to look at tax reform, to increase both revenue for government and increasing equality. First one is a more progressive income tax process. Some people have advocated for making the top marginal rate back at the levels that existed during the Depression in the last century, up in the 70 to 90% range for the top marginal rates. A financial transaction tax, sometimes named after an economist named Tobin, the Tobin tax. This is targeting the fact that many people gain vast amounts of wealth by rapid trading on the stock market, just rapid flipping of stocks around without adding any value to anything. So it's trying to slow that up a bit. The third one is a progressive income tax. Many countries have a progressive inheritance tax. We don't have an inheritance tax now. We used to have, but it was lobbied out and it's gone. But many countries have this. And many people suggest it could both increase revenue and equality by putting something for the idea of a 1% tax on any inheritance over $1 million, something of that order. Another important one here is closing the existing loopholes. Some of them, there are many loopholes, but some of the major ones, capital gains is taxed at much lower rates than income is. There's income splitting allowed between couples, and stock buybacks for corporate CEOs and executives is another one. Another important one is to close offshore tax havens, countries where they attract corporate registration so that they don't have to pay taxes, and for the wealthy to have bank accounts so they don't pay a tax on their wealth. And so once those offshore havens are closed and there are international agreements in place around wealth taxes, we should be looking at introducing a wealth tax. But without those measures taken, it's a very difficult thing to administer. But it could again be up in the range of people who are earning or who have wealth in the order of billions of dollars can afford a marginal tax on some of that wealth. The next bullet here is to reform corporate taxation. Increasing the carbon tax, for example, would help with the environment, and taxing so-called externalities. This refers to the fallout from corporations that doesn't get taxed now, such as the pollution caused by fossil fuels and the health damage from alcohol consumption, the health damage from tobacco and junk food, and change the royalty system and stopping fossil fuel subsidies and bailouts. Next slide, please, Sherry. And then just moving here to increasing the access to public services, having free education from early childhood education and kindergarten right through to college and university level, and including skills and trades training. Having free public transit, getting a pharmacare system into place, and importantly, as came out of the COVID epidemic, improving the care of the elderly, regulating and stopping the privatization of long-term care, It's clear that the workers in long-term care were paid poorly, moving from one facility to another, and unwittingly contributed to the huge fatality rate amongst people in long-term care facilities. The next slide, please, Sherry. Now, importantly, getting to climate action. We need to create a green infrastructure preparing for a total green-based economy, moving out of fossil fuels and moving as much as possible to renewable energy sources. First, installing a smart renewable energy grid right across Canada, installing an electricity transmission cable across the country so that we can share power equitably across the country, installing solar and wind energy generation in all public buildings, and incentivize those installations for residential buildings. Similarly, for retrofitting for higher energy efficiency of buildings, do that in all public buildings, and that's undergoing already. And as at a local community already, many municipalities are providing financial incentives for private residences to be retrofitted as well. And then going to incentives for electric vehicle purchases and converting all government fleets to electric vehicles. The UK is banning all fossil fuels by 2035. That will require charging stations in all buildings, including all public buildings. And very importantly is the adequate storage for renewable energy in all buildings. The next slide, please, Sherry. And more on infrastructure, increasing carbon capture technology augmented with tree planting, phasing out petrochemical-based agriculture, transitioning our society to a much more plant-based diet, increasing infrastructure for active transit, cycling, hiking, and walking paths, electrifying all public transit, and improving water, sewage, gray water, and system through upgrades. Next one, please, Sherry. And then strengthening democracy. Many people are advocating for a proportional representation electoral system such as New Zealand has, and they seem to get good action on COVID through their system there. And better regulating corporate and individual financial contributions to election campaigns and individual politicians and parties. Next slide, please, Sherry. And then just to turn finally here to private and then the academic sectors and the need for international action. In the private sector, as I already have mentioned, improving employee power through ownership and power sharing like co-ops, co-management, profit sharing and unionization, leading to better wages and benefits and therefore pre-distributing prosperity and not requiring as much redistribution. And in the academic sector, particularly better, ideally free access to digital information, databases and libraries. And internationally, creating treaties to cover fiscal issues such as fiscal dumping and tax havens, as well as trade exchanges, as we already do. And I think the final slide, please, Sherry. So the future of Canada and BC with this, if we can move to this kind of a policy framework and agenda, would be a sustainable climate and a sustainable environment, reduce socioeconomic inequality, including reduction, hopefully the elimination of poverty and homelessness, and the oppression of Indigenous and other vulnerable groups, and therefore a more healthy and democratic society. And if we've got time, I guess we do, I can talk a little bit about how we can get M1 passed. Should I discuss that about Sherry, or should we open it up to discussion? You need to unmute, Sherry.
Yeah, that's great. Yeah, please feel free.
Well, there's a lot happening about M1 despite the COVID thing, although that's put it on pause. But as I say, Peter Julian moved this motion in Parliament. Importantly, it was seconded by Paul Manley of the Greens and is supported obviously by the NDP, although it wasn't an NDP motion, it was a private motion. So, that gives us 60 votes in favor of that right now. But we've got to get, there are 338 members of parliament, so we've got to get to 169 votes or so to get this passed in parliament. So as I say, there's around 60 that have indicated their support already. We probably got to get around 100 more. And so there's a process in place. The process is being headed up by an organization that I hadn't heard of until last week or last week. It's called CANRAC. It's the Canadian Action Network, yet another network, folks. And it's French acronym is Réseau Action Climat. That's the RAC part, or the RAC part. So it's CANRAC. They're leading the charge on this, but the good news is that well-known activists are also involved, like Lead Now and 350.org, and getting people like Bill McKibben behind this is very important. So the idea is to get another 100 or another 109 MPs to indicate their willingness to sign on to this. Now, I have, for example, with motion M1 comes a petition, and that petition is available online. And I've done this. I've got a hold of the petition. I've gotten 25 signatures on that petition, and that allows you, that empowers you then to go and speak with your local MP and get them to sign on to this thing. And I've done that with the local MP here in West Vancouver, whose name is Patrick Weiler. And he's a very knowledgeable guy. He's an environmental lawyer. And he said to me, when I talked to him about this, he gave me quite a bit of time. And he said, well, John, everything in this motion M1 is in the Liberal platform. So, and he says, as far as he knows, it's in the NDP platform, it's in the Green platform, it's in the Bloc platform. So he says, this should be easy to get an all-party agreement on this and pass it in Parliament. So that's what we're aiming for, is for people on the ground, and this, I think, would be a wonderful health promotion activity to engage with your local MP right across the country. And an important element of this motion is that it will designate resources to do this right down to a local community level. So we can be looking at the prospect here of Green New Deal municipalities that take on these issues of addressing climate change, inequalities, and improving democracy. So I think it could be a wonderful thing we could move ahead with. I'll end there, Sherry.
That's great. Thank you so much. And I'm going to end the recording in a moment. And before I do, for those who are watching us and have joined in for this presentation, we're now going to move into our second official Health for All meeting here in Vancouver and review our minutes from our last meeting. We're going to look at our terms of reference again, and then talk about how we can support this important work of John and the Public Health Association of BC and their Policy Action Research Committee. So if folks would like to have copies sent of our terms of reference minutes and join our future Health for All meetings, feel free to email us at healthpromotionbc@gmail.com. And yeah, we would be happy to send the information around how to link in. We also do have a Facebook page, which we can also send the link to. So I'm going to stop the recording now to enable us to segue into our meeting and discussion.